Hi everybody, my name is Mitchell Farmer and this is part 2 of Laboratory 1 with the external genitalia. I'm going to start you off with the male external genitalia, beginning by evaluating the peritoneum in the male model. So I'm going to focus, this is a anterior view and I'm going to move laterally. And as you can see, the peritoneum rests atop the urinary bladder at the level of the pubic bone, this being the pubic symphysis that binds the two sides of the pubic bones. And in the cadaveric dissection and in people, the peritoneum actually extends much lower than what is shown in this anatomical model. Here you can see it just resting on top of the anterior aspect of the bladder, but in reality, this being the peritoneum, it extends all the way down here and rests atop the seminal vesicles. And you can envision as the bladder grows, it would grow superiorly and enter the abdominal space, sometimes all the way up to the level of the umbilicus. The peritoneum creates several important fossa, the rectovesical fossa between the rectum and the bladder, as well as the paravesical fossa, which lies to either side of the bladder, and the pararectal fossa, which lies to either side of the rectum. Now, I'm going to get rid of this and move on to some of the external structures of the penis, starting with the root of the penis. I'm going to move us down so we kind of have a feet up sort of view and rotate us around and zoom in. So, beginning with the root of the penis, the root of the penis is essentially composed of what's known as the cura of the penis and the bulb of the penis. The cura of the penis here is covered by, not by Buck's fascia, but by the ischiocavernosus muscle. But essentially the cura is, or are, erectile tissues that are anchored to the inferior and internal aspects of the ischial rami, as can be seen here in this anchorage here, just anterior to the ischial tuberosities. They are continuous anteriorly with the corpus cavernosa of the penis. And so, unfortunately, they're obstructed in this model and can't be seen, but that'd be roughly where the cura is, where the bulb of the penis is covered in this model by the bulbospongiosus muscle. I'm going to go over both of these muscles as well shortly. The bulb is also an erectile body that is bound posteriorly by the perineal membrane and continuous anteriorly with corpus spongiosum. And so it'd be bound approximately here with the perineal membrane that would just be superficial to the deep transverse perineal muscle. The urethra enters the bulb after passing through the perineal membrane, and the external urethral sphincter then travels within the corpus spongiosum. And that can actually be seen here. If we're looking at, just to zoom out to give you some perspective, a lateral view, and I move somewhat posteriorly to the bladder and zoom in, we can see the bladder going into the external urethral sphincter, which then travels through the deep transverse perineal muscle, as well as the perineal membrane if it was present, as it enters what would be the corpus spongiosum right here, once I get rid of Buck's fascia, that is. Now I'm going to rotate us back anteriorly. The other structures of note at this moment are the Glans Penis, which is essentially the head of the penis. And then also within the dissector, there's also the frenulum, but I recommend looking that up on your own as it's kind of hard to describe exactly what it is. But at the end of the Glans Penis, there is the external urethra meatus, which is the narrowest portion of the urethra. This is worth considering when you're doing, say, a catheterization. Now, on to some deeper structures of the external male genitalia. There is Buck's fascia, as I've highlighted here, and I'm just going to hide that. The upper and lower Buck's fascia. Then there's the tunica albuginea, which I'm also going to hide to expose the corpus cavernosum and corpus spongiosum I was talking about earlier. Just a note on Buck's fascia, it's the deep fascia of the penis, and it is a continuation of the deep perineal fascia, which forms a strong membranous covering surrounding and binding together the corpus cavernosum and the corpus spongiosum. And as you can see deep to it, there are several arteries and veins. This is the superficial dorsal vein of the penis, it is singular and non-paired, and it would have been just above buccal fascia. It is a continuation of the internal pudendal. I'm just going to hide it right now. And just deep to that is the deep dorsal vein of the penis. Lateral to either side of the dorsal vein of the penis are the dorsal arteries of the penis, which, unlike the vein, are paired and also are continuations of the internal pudendal artery. And then on either side of the dorsal arteries is the dorsal penile nerve, which is the terminal branch of the internal pudendal nerve, which I will go into more detail in Laboratory 2. So that's pretty much everything I want to discuss in regards to the external genitalia of the penis, and it's pretty much everything I can discuss, actually. So I'm going to move on to the female external genitalia. Just pulling up that view. So I'm going to begin by having kind of looking at like a feet looking up view, just covering some of the external anatomy of the female. I'm going to zoom in here. So I'm going to start with the labia minora, singular being labia minus, as well as the labia majora, found here and here. Within the confines of the labia minora, so everything medial to it, is the vestibule. And the vestibule contains several important structures as well. It contains the urethra and the urethral orifice, as well as the vaginal opening, or the vaginal orifice. Just superior to that is the prepuce, or the clitoral hood, and just inferior to that is the clitoris. So that's kind of a real whirlwind external anatomy of the female. I'm going to take us out here and move laterally so that we can see the peritoneum. Much like the males, the peritoneum falls over top of the bladder, but it also falls over top the superficial aspect of the uterus. And between the uterus and the rectum, there is the rectouterine pouch of Douglas, approximately here. And then similarly to the males, there's the paravesicular and pararectal fossas, also created by the peritoneum. I'm going to hide that now. One thing of note for sure is that in the cadaveric dissection, you'll be able to see the broad ligament of the uterus, which is a wide fold of peritoneum that connects the sides of the uterus to the walls and floors of the pelvis. Unfortunately, the broad ligament isn't present in this model, so you will not be seeing that here, but you will see it in the cadaveric dissection. Similar goes for the rectouterine folds, but there are a couple ligaments of the uterus present. For example, there is the round ligament of the uterus, which I can highlight on either side here. So the round ligament of the uterus, if you recall, is kind of similar in where it travels to the male spermatic cord. Not homologous, but similar in where it travels. It travels through the inguinal canal and terminates in the labium majus. It is the homologue of the male ductus deferens, specifically, a remnant of the gubernaculum. And if you've read the dissector, you would know that the gubernaculum is an embryonic structure that provides a guiding tissue connection in the retroperitoneal space, so retroperitoneal being over here behind the peritoneum, between the gonads and the labioscrotal swellings. So that gubernaculum went from here to labioscrotal swellings, and there's several remnants of it, embryologically speaking. There's in fact two. Once the ovary is in the final position within the pelvic cavity, the gubernaculum fuses with the uterus and splits into two parts. There's the round ligament, as I've highlighted here, and there's also the ovarian ligament proper, which I can show you here. If I zoom in and rotate a bit, you have the ovarian ligament, which attaches between the uterus and the ovary, and in very close proximity you have the round ligament of the uterus. And of course, in males, the homologue is the scrotal ligament of the ovarian ligament. The last ligament I wanted to talk about is the cardinal ligament. seen here and here, anchoring the uterus to the walls of the pelvis, or the lateral walls of the pelvis. The cardinal ligament is a triangular ligament that fixes the uterus to the lateral walls of the pelvis and transmits the uterine artery and vein. You can actually see that, if I hide, say, half the uterus, you can actually see that on the right side of the model. Here is the cardinal ligament, and you can see it transmitting the uterine artery and the uterine vein, highlighted here and here. Okay. I've already discussed the perineal membrane. There's a bunch of other things in your dissector, such as the bulbospongiosis, the bulb of the vestibule, the ischiocavernosus, the cura of the clitoris, glans clitoris, and the greater vestibular glands. Those are all pretty much impossible to see in this model, and in fact they're quite difficult to find in the cadaver as well. But I recommend looking them up and learning about them in the dissector. So that's pretty much a whirlwind tour of female and male external genitalia anatomy. I will see you for Repro Laboratory 2.